First, I would like to ask your permission to use this video for educational purpose and on the internet.
Oh, yes.
Tell me about your symptoms before our surgery. What were your symptoms?
Pain.
Tell me about it. 1 to 10, how bad, how long?
Well, it's only 1 to 10, but it was above 10.
About above 10?
Above 10.
How long was it above 10?
Since probably 95.
So it is long time. You had pain for a long time.
Yep. And everybody just kept telling me, go to therapy, go to therapy, go to therapy. And
And you did that though.
I was doing therapy for the same company or same doctor's office, if you will, since 2012. And I finally started yelling, if you're not going to listen to me, why would I listen to you?
So it's 9 years. That's a lot of treatment, and you weren't getting better.
No, I was getting worse.
We're getting worse. How far could you walk before the surgery?
At the time, maybe half a block.
Half a block. What would happen if you would walk half a block? What
I'd get weak.
You get weak. We have a name for that. We call that claudication. Okay? So you got a surgery about 1.5 years ago.
Right.
I think it's interesting for people to know that today you're not coming for the lower back problem anymore. You're coming for other problem, including your neck, some problem that obviously it's different, has nothing to do with your lower back. But I want to concentrate on your lower back problem.
Okay.
Now, we did that surgery in February of 2021, almost 1.5 years ago, almost. And first of all, do you remember the surgery?
Vaguely.
Vaguely, good. We want you to forget those memories. But this is my record of the surgery. We did 2-level fusion, L4 to S1. And first of all, we did that surgery in 48 minutes. In the university, we did that surgery. Our blood loss was half a cup of coffee. That was all what we lost blood. And you stayed in the hospital just 2 nights for this big 2-level fusion as well. Initially, after the surgery, you had nerve irritation. Now, I'm going to go one by one. How long after the surgery did you start walking after our surgery in the hospital?
The next day.
The next day. And we talked about that many of my patients go home just 1 night after the surgery, but you end up staying 2 nights. Tell me, what happened?
There was a blizzard outside, and I was afraid I was going to do more damage getting home than staying an extra night.
And that was smart to stay. We don't want you to go out right after surgery in unsafe condition and fall. But generally, actually, I remember if it wasn't for extraordinary circumstances, you would have been gone home, say, next day after the surgery. As well, I asked you about the nerve irritation. Your response was, what nerve irritation? Because you didn't remember that, right?
I don't remember it.
Yeah. 2 weeks after surgery, I checked on you. You still had that nerve irritation, but it's very obvious that it went away and you even forgot about it, which is a good thing. So, but having said that, I think sometimes what happens after a few weeks after the surgery, some people get that. About 15% of our patients get that nerve irritation, but most of them are like you. They don't even remember that they had it, and they don't remember when it went away because it goes away very gradually. Like you don't see your children growing because they grow ever so slowly. Now, how is your situation with the lower back, with the pain in the back and the leg? How is that now?
The pain has lessened considerably. I don't even, unless I've done something stupid, like lifting something too heavy.
Yeah.
I don't even notice it.
No. When did you notice that the leg pain is gone?
Didn't even notice it.
But after the surgery, did it go right away? Did it take a few weeks or a month?
Probably a month.
Yeah.
I don't know.
You don't remember?
I don't remember.
Yeah, that's a good thing.
It is
not
a wonderful
thing.
It's like, I had pain there? Really? When?
Yeah.
You know.
My note from 2 weeks after the surgery says that your leg pain was gone right away. The back pain took obviously a few months to go away based on my notes. But it is a good thing that all that, what you had, what you said your pain was 12 or something, it's a good thing that you don't remember that.
Right.
Because we want that to be your past and not your future.
Exactly.
Excellent. Now, I'm overall happy with your back, with how you improved and so on.
I am.
What question or comment do you have for me?
None. It's just that my question is why didn't they send me to you sooner?
Yeah, and that is a very good question for lots of my patients that, why did it take so long to come to a specialist like me? And the answer to that is actually very easy. in a regular surgery, the risk of surgery is so high that we doctor, we hesitate to give the patient the option of the surgery. We do.
Oh, I understand.
Because open surgery, you don't lose half a cup of coffee. You lose 10, 20 times more.
Right.
The risk of infection is 30 times more. Stay in the hospital is a week. You lose a lot of blood and lots of recovery. That really reduces our willingness, our surgeon, and my colleague, to offer the surgery. The only difference is that you didn't get that surgery. You got a minimal invasive surgery, the OLLIF technique that we actually developed many part of it. There are not many people doing that. And that, so your improvement, your history, how you improved after surgery, even in 2022 is not the regular way how people improve or get the surgery done. And that sort of really have a bad taste for all doctors. We hesitate to take care of people like you because we know the alternative is a risky procedure. Now, hopefully this video helped my colleague to understand there is a better way of doing that. So we shouldn't be so hesitant and let's send a patient like you 10 years to treatments that we know they are not very effective.
No, well, it kept me walking, so I'm not complaining about doing physical therapy, but this all started from literally a drunk driver accident in 1988, and I've been doing therapy since 1989.
Yeah.
It's 2022.
Yeah.
I'm sorry, I wasn't going to wait for any more help by going, oh, physical therapy.
Yeah.
I swear by it, I'll do it. I do it just to keep walking.
I think 3 to 6 months is our protocol, is all what give a patient. After that, we look into other option, and our option, because the risks are so much lower, can help a lot of people like you.
Oh, yeah.
So in that sense, thank you for helping me educate not only my patient, but as well my colleagues.
Yes, please, learn, you know.
Yeah, thank you so much. I appreciate it.